They're doing a great thing. It's such an uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.
Hey guys, welcome to the broadcast. 888-659-3727 is the toll-free number. We are here for you to help you guys out with anything and everything hair loss and to take your calls. So if we don't receive calls immediately, I'm leaving. Because you know what? It's a really nice day here. It's been raining, and now it's just been a really nice day. And I may want to get out early.
It's a beautiful day here in Vancouver. It's a nice sunny with a blistering 0 degrees Celsius right on. But I do got stuff to do too.
We all do.
If no one calls.
Oh, Jesus, look at this.
It's busy up here in TBT Studios North. Get ready for the trip to the wild UK in a week and a half. Doing live streams with doctors, visiting clinics, all that fun stuff.
Cats and dogs.
Living together. Complete pandemonium. I love the pop culture references. That's good.
No one gets it.
How are you?
I'm good, man. Phone number is 888-659-3727. For some reason, I cannot hear myself in my headphone, but I hear you fine, so I have to kind of figure this out. What's going on here?
You're coming through fine on my end.
Okay, good. It's just weird. You know what? It's really weird. I'm not coming through the board well. Hold on.
Hey, guys in the chat room, what do you think? How do we sound?
Check one.
How does Spencer sound? How do I sound?
Check 1, 2, 3, 4. This is so weird. Hold on for a second,
Check
guys.
1, 2, 3, 4.
Joe, take it away.
I'll take it away. Still waiting for people to respond to the question. Spencer is now off audio. I heard heard that disappear. No one's going to answer? Let's see. Where is it? Still loading. Yeah, no one's answering. What's going on? Are we... Yeah. Okay, there we go. House says, sounds good. I'm on a phone. All right, that's good. Anyway, while Spencer's working on that, if you guys didn't see it, I did do a YouTube short and then on Instagram. I asked the question, when I go on my trip to the UK, and then eventually maybe next month in March or April, I'm going to Turkey, visit clinics there. I will be visiting different clinics in the States and Europe. Definitely Switzerland to go see Haddingen Hair. Maybe a couple of other clinics. We'll see. But what do you guys think of me trying to set up a live stream so we can do Q&As? The timing would not be the 3 o'clock normal Pacific time that we have here due to the time differences, but varying times throughout the day, different times of the week. Would you guys be interested in that, or do you like the pre-recorded stuff better? You can say something in the chat room, because I am taking the feedback and considering it, because I do want this to I do want to get the most mileage out of my miles. Get it?
All right, so I could barely hear myself, but I see that I'm coming through in the software, but it's very, very odd. Let me see if does this do anything? I think that may have done it. You guys can probably hear me now. 888-659-3727.
Sounds no different.
Sounds the same? Okay, good. I was just getting no feedback to myself. All right, guys, listen. Call the program. We're here to answer your questions. The guy in the chat room, I just read your question. Why do I only take 5 milligrams once per week? I actually take it about once every 4 days now. The reason for that is I started using ProScar 30 years ago. And when I started using it, no one was talking about a 1 milligram dosage. It wasn't even being written about that. They were testing 1 milligram dose.
Yeah.
When I started, finasteride, there was an there was a Freudian slip, a side effect for those who were taking it for benign prostate hyperplasia. And that side effect was people's hair started growing back, guys who had been balding for many years. And I'm like, damn, let me see what this is all about. I found a doctor willing to prescribe the drug after people were telling me he was going to turn me into a woman. I took the chance. Pretty sure it didn't turn me.
The outfit.
Yeah.
We all see the outcome.
We all see the outcome. So, let me check my bra. But, you know, all in all, it worked out. And so, to make a long story short, instead of dropping down to 1 milligram a day, I decided to kind of titrate my medication as I learned more about people who were doing well on a lower dosage. I didn't want to stop the 5 milligrams because it was working really well. So I lowered my dosage slowly. And then I realized that intermittent therapy seemed to work for me. At the time, every doctor was saying, how is intermittent therapy going to work? The drug has such a short half-life. I'm like, I don't know. I'm not a doctor.
Exactly. I don't know these things.
Yeah.
Why are you asking me? You're the doctor.
You're the doctor.
You should know.
But now, word on the street is, not only does intermittent therapy work, but starting with a very small dosage of finasteride intermittently, and then titrating to a level that you feel comfortable with tolerating, seems to be very effective for a lot of young guys, especially the guys who are really shit scared of taking this drug. Now everyone is pushing intermittent therapy. Oh, you don't need to take the drug every day. You can take it every other day if you want. You can take it every third day if you want.
That's how I started it.
Yeah, and then
every other day.
Yeah, and then now there's some studies, and I use that term loosely. When people ask me there's one person demanded that I provide her with peer-reviewed studies about the possibility that Ozempic can trigger female pattern hair loss. I didn't have the time to write this person back, but I'm just like, do you even know what a peer-reviewed study is? What that actually means in this culture? 70% of the studies we find out are completely, I don't want to say complete BS, but they find out that they could be pretty easily refuted. And I think it's up to 90% of current studies can be at least questioned across the board. Anyway, don't kill the messenger. Don't shoot the messenger. If you're taking Ozempic and you're a woman who's being diagnosed with chronic telogen effluvium, get checked for miniaturization. If your hair is miniaturizing, it's not chronic telogen effluvium. It's female pattern hair loss that was triggered. Easy way to check it out. No peer-reviewed papers needed. Could it be coincidence? Yeah, it could be. So anyway, I'll take your calls in a second, guys. So back to me, which is more important. So now every doctor is saying, doing intermittent therapy, telling people to titrate. Now, I don't need any credit, but I wrote about this decades ago, and doctors didn't even want to hear it. So, I mean, look, a lot of things in life are trial and error. A lot of things in life are common sense. That's why I think Joe was essentially saying that what we do is the DOGE of the hair loss industry, because we deal in common sense.
Exactly.
We deal with the truth. I went into this industry 30 years ago dissecting every minute crevice, shining a light in the dark recesses of this cesspool of an industry, and no one liked it. They tried to cancel me as soon as I got out of the gates. And first there was the industry, and then there were those who were like running message forums. That was kind of fun. And then, there were those who today it's those who have a confirmation bias because they effed up. They ended up getting 9,000 grafts in one shot. And they didn't want to hear the truth. They didn't want to hear the possibility that they're effed. That in 5 years they're going to live their lives with nothing but scars on their head and their dicks in their hands. Don't shoot the messenger. I think that was Joe's point of kind of making that comparison today. I could be wrong. I don't really pay attention to you for the most part.
And the point of it was, like it or not, there's something going on where the goal is to do things that are common sense. Again, agree with it or not, that's a whole different discussion. But that's the approach, and that is the comparison with what we do. It is common sense approach, transparency about what works, what doesn't, and basically the truth that no one else is telling you. It takes people with a certain appreciation for how this industry works that can tell you the truth, and that's what we do. And there's no money in it for us, to tell you the truth. We don't make money sitting here talking about all this happy horse shit.
Probably one of the biggest mistakes I've ever made in business.
I know.
When I think about it.
I actually had a friend of mine who's starting a YouTube channel, and they're growing fantastic, or their growth is fantastic, and they got to the point where they can monetize, and they were talking to me. They're showing me how much money they're making. It's not a lot, but comparatively, like if you scale this over the next year, the curve at which they're growing, they're going to be making some decent money in just a year.
Yeah.
I've been doing this 10 years, this YouTube thing, and I've chosen not to monetize it. It's like, shit, how much money could I have made? And then, of course, if it gets bigger, which we're hoping, it's like, but no, that's not what we do. That's not what I'm doing with this channel.
Well, with all
Spencer's doing,
with all transparency, I make money. I figure out a way to make plenty of money.
Well, of course
enjoy my life.
Not through this.
Yeah, enjoy my life, and do what I do and still earn.
Like we don't live in a cave. At least I don't.
Right, and earn. And there's no issue. I have no issue with that. The problem is, it's the low-hanging fruit that seems to do the best online. Now, and guys, hold on, I will take your calls, 888-659-3727. I've been putting the tiniest bit of effort into Instagram, and I learned that I basically just have to kind of really provide the basics of basics. And if you do that, you skyrocket. Mm-hmm. You just take off. You create a hook that's interesting to these people, and you provide the basics of information. And, there are some people who are upset that I don't provide them with the solution. And I have to tell them, look, you got 150 other channels that will sell you some magic hair loss beans. This is the wrong place. But I do find it fascinating. So you have to really kind of, I would say, make it. And this is not, for the people who follow me, I appreciate it. I'm glad that you do, because it's going to help others get this message. But I learned that just having a conversation about the reality of this industry and making it somewhat, I don't want to say esoteric, but, talking about the nuances of the field, it doesn't hit on social media.
No.
Can't do it. You got to tell people why they need the shampoo every day. Or 7 hacks for, saving your hair. That's what hits. I'm okay with that. Not that I accept it. If I have to do that to help get the message out there about what we do, then that's great. Save a few lives, still earn. Look, Joe is absolutely right. I don't have to turn on this camera, take these phone calls, post anything online. Deal with the nonsense that I deal with online to earn a living. I could essentially be invisible and continue to earn, and I've invested my income over the years wisely and all that stuff that you're supposed to do. I don't live like a baller, not anymore at least, since the last time Joe was at my house. But I've just I've learned to enjoy my biggest, what I enjoy most in life is my freedom and my time. Those are my most important assets. It's not wearing a $300,000 watch or driving a Bentley Continental or some shit like that. And when I was a kid, I thought a little differently. I'm going to be honest.
Well, it's the classic story. As you get older, you appreciate the finer things in life, or not the simpler things in life. Peace, quiet,
yeah,
lack of drama,
yeah, morning wood, shit like that.
Good movements.
Guys, the phone number,
the simple stuff.
888-659-3727. I guess the point is, Joe is right. Maybe we are the idiots, but we're here to provide you with the truth. And even if it's only 100 people watching, or 2,000 people over a week that find this particular broadcast, great. Instagram, I put something up, and maybe 300,000 people. That's fantastic. We're just here to tell you the truth, and that's what we're going to continue to do, I guess, until we decide to stop. Hey, you're on the air. Who's this, and where are you calling from?
Hey, Spence. Hey, Joe. This is John from California.
John from California. What's happening,
up, John?
brother?
How's it going?
I called in last show. Pretty good. Thank you. I called in last show. I'm the longtime listener that started listening to the radio show like 20 years ago in college.
When you were in college, yeah. I remember you.
Yeah. Mm-hmm.
Yeah. So I just wanted to follow up with you guys again. Thanks again for the advice on treatments. I've been reading up on adding in oral minoxidil and really considering that route. But I wanted to call in today and talk to you guys about, maybe pick your brains a little bit in terms of some of these doctors that are getting a lot of attention in the field. I've had a hair transplant myself, if you guys recall.
I think I do recall that.
Yeah, hairline and temples. But online, there's a lot of buzz around Dr. Zarev, and I think Joe kind of touched on his technique and gave his thoughts in the past before. And he's kind of known for really pushing graft numbers in terms of taking out 12, 13,000 grafts, and he has his own proprietary tool and all this stuff. But there's this other doctor in Brazil. His name is Dr. Felipe Patella, and he's another guy that's restoring, Norwood 6s, Norwood 7s, but his approach is a little different. He'll take like 7,000 grafts from the traditional donor area, but then he will heavily harvest below the neckline and pretty much take everything that he can from that beard area and then maybe even dip into chest. Now, I know based off of some studies that had come out in the past from, reputable doctors like Shapiro, the best way to maximize graft numbers was starting out with FUT and then transitioning to FUE. But
that's not graft numbers. That's just grafts that actually stick around with you throughout life. You can maximize graft numbers the way these guys are both incredible mechanics, but they are unable, at least at this point, unless they have something up their sleeves that I don't know about, they're unable to change a human physiology. And the hair loss process and the progressive nature of male pattern hair loss. So, but I will give them, I will tell you, and I'll let you finish your question, they're both incredible mechanics, incredibly impressive. You always have to look at someone with a jaundiced eye who has a proprietary tool that they will not share with other physicians. That's a very important thing. And I can tell you some stories about, there's one point where I accepted Dr. Zerv as an associate member based on the recommendation of another doctor. And unfortunately, there was some issues. What's going on my computer? Some issues, not with his work, but political issues that really did turn me off. And I kind of feel that I dodged a bullet, that it was kind of like a short-term situation with him, because as I'm seeing the numbers go up and the patients getting younger, there's no way that I would be able to have him on, even as an associate member, which is a kind of a trial membership on the IHRS. Yeah. So I feel very fortunate that the politics kind of came into play, and I didn't have to essentially say, "Look, man, I gotta kick you out of this thing." So, but go ahead.
So thanks for sharing that. That's interesting. I guess the last part of my question is, in terms of someone like Dr. Patella, his approach of, taking out those beard and body grafts, I was always under the assumption that hairs on the scalp have the longest anagen phase, and beard hairs come second, and then chest hairs and everything else kind of last. But these results that he's posting, these guys are going from Norwood 6 and Norwood 7 to what you could perceive as a full head of hair.
They're beautiful.
And I'm wondering,
do
these results, is this just like a 1 year, like, oh, this is the best it's going to look at 1 year, and then all the anagen hairs get desynchronized, and then the chest hairs?
Very good question.
And the beard.
Very astute.
A damn good question. Yeah, very astute young man here. That is exactly what I won't say will happen. There's no guarantees except for a second surgery. Joking.
Well, they won't be able to have more surgeries unless they decide to go for a strip.
Yeah, exactly. But the likelihood of that happening is high, where all the grafts are taken out from wherever the source is, placed in the scalp on the same day or over 2 days. They all go through their telogen phase at roughly the same time. They all start to come in back into anagen at roughly the same time, 5 months to 10 months, whatever, in that time frame. And then they're all doing their thing, but then some of them say, something's not right. I shouldn't be growing yet. I should be back in my telogen. I'm tired. I need to go back into telogen state. And at 18 months, the doctor gets a call, I'm losing my hair transplants. And no, that's not what's happening. It's just some hairs are going back into their original growth cycle. Others are staying in the growth cycle that they're in now as far as the anagen state. And yeah, I mean, it could look 30, 40% thinner at certain points of the result after it peaks at, say, 14, 15 months, and then start to turn around to where it's not quite noticeably thinner to the patient, questionable to others other than the patient. But in many cases, that is how it works out. So when you have such high numbers like that, and you have the percentages are consistent from one patient to the next. It just depends on the numbers. 30% of 12,000. That's a big deal. That's a big deal. So
here's the thing. I don't want to come off as some sort of a. I'm not going to say a hater. What's the word? Luddite. I don't want to come out as someone like when I started.
Skeptic, Spencer.
Say it again.
Say skeptic.
Yeah, skeptic. But, I was a guy who was very obviously all into FUE. I keep repeating myself, but I introduced it to the U.S. and to Canada and all these doctors, North America. No one wanted to do it. I saw that the numbers could be improved. I also knew that it was a great ancillary procedure, as I always spoke about. And I was pleased to see these guys getting bigger numbers with a combination or hybrid procedure, but still kind of going in a gradual pace. Maybe 4,000 or 5,000 was a decent-sized case, a big case, 6,000 at the most, which is kind of risky. To my knowledge, again, the physiology of human beings have not changed. The donor dominance, theory of donor dominance hasn't changed. The only reason the theory of donor dominance really was able to be kind of, in quotes, proven for the long term is because at least back in the day, most of the hair was taken from really the occipital, the most dense and the most DHT resistant areas. As even the strips started to get a little bigger, doctors were realizing, well, maybe we go a little bit too far advanced from the tragus, like your ear line, and we kind of go a little bit too far into the temporal points. Maybe that hair is not lasting as long as we thought that it would. And it was happening even with strips. So, look, all I can tell you about these two guys is they are incredible mechanics. These guys are willing to work really hard. They figure out a way to not immediately damage people's donors, to utilize every possible hair, again, without causing a immediate depletion, a visible depletion of most people's donors. They're also able to implant the hair without any noticeable damage, at least that I can tell, so the hair is growing. But that's not going to change the long-term outcome. And I want to state this again in case this is sent to Dr. Zarev. I was convinced to take Zarev on. And, he was upset, at least according to what I understand, that there was another guy in his area that was accepted as an associate member into the IHRS. He was also, one of his colleagues was also very upset with me and Joe at the time. And this is a colleague that he looks at as a real mentor. Once all that started to happen, Zarev contacted me and said that he no longer wanted to be in the IHRS. And he stated the reason why. And that was because of this competition. Again, I kind of felt like, oh, this is a blessing in disguise, because as things were happening, I'm like, I'm going to have to tell this guy that I can't keep him on. It went from 3,000 graft cases to 7,000 graft cases to 9,000 graft cases. And, the average case was a lot smaller when we first brought him on. I don't know if you remember that, Joe. But then he started to really promote these big cases. And I would ask him about it, and it's just like, well, this is what I do. No one else can do this because I have this proprietary piece of equipment. That's just not the way it works. So I like to give people full disclosure on what went down. If these two doctors were to apply to the IHRS at this point, I would not, in good conscience, be able to take them on.
Mm-hmm.
Interesting.
Yeah.
Interesting.
I mean, they could pay me $10,000 a month. I could not take their money. Joe's like, really? Yeah. You know what?
Really?
If I decide to take their $10,000 a month, we'll just erase this. We'll delete this. All right?
Everything can be deleted.
This never happened. No, but that's just the truth. At one point, I did contact Patella out of curiosity through Instagram. This is a long time ago, maybe 2 years ago. I'm like, listen, everyone's asking me about your work. I kind of wanted to know how he's doing it. I wanted to know about the AI. The guy never got back to me. And I thought after about 2 weeks, and I was seeing more stuff, I'm like, I'm kind of glad he didn't get back to me, because maybe if he did, he would talk about the IHRS as opposed to just answering my questions. So all I can tell you is, if it was my brother, it was a young guy, especially, listen, all right, this is going to sound maybe contradictory. If you're 55 years old and you have really good donor and your lateral humps are pretty high and you want to take this chance, there's a good chance that an older man can get away with years of a really good head of hair from these guys. Right. Maybe till they die. I mean, if you're 55 years old, the average life expectancy is 76, 73 now, whatever. So if they make it the average point, they may get away with it. But if you're 25 and you start with this, in my view, in my opinion, based on 30 years of experience, what would the term be? You're fucked.
Yeah.
I look at it from a different angle, though, because my
Joe will take the money.
My difference of opinion or outlook on this is from having dealt with patients that did have these big surgeries that were supposed to be, not one and done. That's a mischaracterization. But the idea of getting full coverage in one shot, it is really exciting. I know all about that because I was part of the very first movement, the very first situation where you could legitimately get full coverage in one session, one surgery.
Those were exciting days, actually.
They were very exciting days. Like, it's like anytime I'd see one, it'd be like, God damn it, man! So much hair moved in one surgery. So happy for the guy. Let's get it online. Let's talk about it. And guess what? There was a case where, there was a day when a phone call came in. Hey, Joe, I don't think it's working. What do you mean? Blah, 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 blah. Fast forward 1 year. Not quite the growth that you want. Sorry, most of your grafts have been used. What do you do now?
Yeah.
FUE wasn't around back then or in any, viable capacity. So I learned a very valuable lesson. Just because you can doesn't mean you should.
Yeah.
Because what doesn't go away is one of the very few guarantees in this surgery. Shit can go wrong.
And I want to
when
make
they do, what do you have to fix it with?
Well,
You've already used everything.
I want to make it clear, and those are very strong points. I want to make clear to both of these doctors, because there's a language gap. I've spoken to Zarev, and it's not easy to communicate.
Yeah.
I believe these are both probably two of the most skilled mechanics in the game. I mean, they're really good at what they do. They can move hair like practically nobody else. They're both young, fit. They have a very unique outlook. They want to really push the boundaries, which in many cases could be a good thing. In this particular case, it probably isn't for most patients, in my view. Now, I would love for them to prove me wrong. I would love to see a young patient 10 years from now, if I'm still alive, who's been able to maintain all the hair that was moved. Now, I'm sure there's going to be plenty of patients who started at 55 who are going to be 65 and look great, if they were concentrating on older patients. But that's not what you see. The people who are on Reddit and other places, these aren't the 50-year-olds. These are young people who are looking for hope, who are willing to travel to other parts of the world to get these incredibly, they're called giga sessions. And they may be happy for a while. I wish I could say something different. I wish I could say, you know what, this is the way to go. We're going to make sure that all these doctors really start to push the envelope, because they all have the capability of doing it. And if they don't, they can hire people, younger doctors, to help them. Mm-hmm. But physiologically, it just doesn't make sense. It does not, the math doesn't work when it comes to the future.
And the one thing that irks me a little bit is sorry, Joe.
No, go ahead.
The one thing that irks me a little bit is one of those doctors is very anti-finasteride. And the other one is basically saying it's optional. Whoever wants to use it, you can use it, but you might need more surgeries down the line. And to operate on someone, I say below 40, that's not on finasteride, is
who's anti-finasteride? The guy with the full head of hair?
Dr. Patella. He's very anti-finasteride. His typical protocol is something like topical minoxidil, oral minoxidil, and I think like clobetasol shampoo with ketoconazole shampoo, something like that. Yeah. So no five.
Well,
five
of course, he's
inhibitors.
anti-finasteride because body hair takes up 30-40% of his typical graft case.
That's why I keep you around, Joseph. This is why I keep you around.
It's antithetical to the idea of using body hair.
Yeah, that's a beautiful point.
Body hair is affected adversely by DHT inhibition.
Holy shit.
Yeah, absolutely.
Aha.
Look, and I
the way it
again,
works.
I don't want anyone to think, and I hate this because these are human beings too, you know. So I don't want to assassinate anybody's character. Again, I think they're both incredible mechanics, hard workers. They've been able to market themselves very well, and frankly, it's young guys like, you know, the guys that you're seeing write about this online who are doing most of the marketing for them. It's usually the most vulnerable who essentially become the biggest soldiers for people like this. And, you know, we saw that with like Cohen Go back in the day with his
my God.
so-called hair multiplication. It's the most vulnerable.
Oh my goodness.
Yeah.
I forgot about him.
So you know what I'm talking about. You've been around for a while. So it's the most vulnerable of the bunch that become the greatest soldiers for these guys online. And they will fight to the death for these guys. And they will make these guys multimillionaires. It doesn't take a long time in this game. 5 years.
And a lot of times the guys haven't even met the doctor.
Yeah. 5
They
years.
just want to believe so much that it's like, how dare you disagree with this guy?
And then when all of these potential walking wounded come back, it's over.
And I'll say this: it's like, sorry to interrupt, but you know,
it's fine
you're
with me.
saying, you know, no character assassination for these guys, you know, because they're great mechanics, and I agree. But what I'm talking about is the way I look at it. They're still fairly new to the game as far as their age and the number of years of experience they have, especially doing these big surgeries.
They haven't seen the damage.
I guarantee you that they will have a case where they thought everything, you know, they can look at their surgical notes, not a bleeder, easy placement, easy extraction, skinny groupings, all the things that doctors write down in their surgical notes, and it'll still come out looking terrible, low growth, just a bad looking outcome. Patient will be unhappy, and my concern in situations like this is, will they recognize the issue for what it is? Or will there be too much ego in the way for them to acknowledge that something isn't right? Like maybe something on our end, instead of trying to blame a patient. Not saying they would, because I know Dr. Zara, but I know nothing about Dr. Patella. But that is a very real possibility, and then more people will be harmed because of a lack of situational awareness. I've seen it happen, and I see it happening with other clinics as well, where they are inching their way up to becoming a clinic that's known for bigger sessions, and that's fine. I love when these things work out, and in better clinics they usually do, but there are those times. There's always the first guy, and then there's going to be another one and another one after that. That's just the way the industry works. So, you know, not harping on their abilities, I'm just hoping, you know, God forbid it happens, but it will happen eventually. They will have an unhappy patient. God forbid that patient goes online and drags that doctor through the mud, ruining their reputation. I've seen that happen too.
Look, I would love to. If they were actually able to communicate in English, you know, so that I can understand them better. I don't know if this guy Patella, if he can, but I would love to talk to them. I mean, when you think about time on tissue, think about Zverev time on tissue. Again, there's a reason why he was an associate member, even though he had the cases. You know, I wasn't 100% sure. There was a doctor down in Atlanta that recommended him highly, said that you really need to get this guy on board. I met him at FUE Europe. Very nice guy. He confided in me about a lot of things. He seemed to be very interested in evolving the field. You know, I'm a human being, and when you meet somebody in person, you know, you don't want to just shoot him down right away. I mean, the work was good. But as things progressed, and again, I'm so glad that this political situation happened, and I didn't have to contact him and say, listen, brother, you're out, because I think that the long-term results of a lot of these cases may not be what you hope for. and I can't give the seal of approval when there are going to be so many young, vulnerable guys who look at that and say, okay, well, Kobren says it's okay, or the IHRS says it's okay. And again, not everybody even looks at that. You see all these people online who are just discussing it amongst themselves. And they're just looking at these numbers and these incredible before and afters and this video and these cases, and they're impressed. I get it. If I was 25 years old, I'd be impressed as well. I would think this is cutting edge. Mm-hmm. But when you're in the game for so long and you really understand it, and that's why I just hope that young people who are listening to this just take the time to try to understand this process deeply. Not just, oh, these are two old guys who don't know what they're talking about, or they're trying to hold on to some sort of power in the industry, or whatever these people think. You know, that's just not the case. We've been around for so long. We've seen, it's kind of like a contract, right? Anytime you sign a contract, the reason certain contracts are like 20 pages long is because all that shit happened at one point in history.
Yeah.
And the same goes for this industry. And these guys know that this stuff could happen. For some reason, they think maybe in their hands it can't, or it's going to take longer. I don't know. You're very patient, by the way, as far as listening to me. I appreciate that.
No, I'm really enjoying this call. That's also the hard part for me, Spence, is because I've been there as a young guy when I was 19, 20, going through the forums, and there's just desperate young guys there, and they'll cling on to anything that gives them hope. So when they see, just like you said, they see these results and they're blown away by it, and there's a possibility of getting 13, 14,000 grafts. I can go get a 5,000 graft procedure and I'll be good.
Right.
But it's really not like that. Yep. And I don't know, maybe I can share it during this show or maybe during another call, but I am actually a repair patient myself, and I didn't get surgery until my early 30s, but I went to what many perceive as a very reputable doctor, has a very known presence on YouTube with his results, and I got my donor demolished on one side. His technician wrecked my donor, and my results on top, I had maybe 40% growth, and the end result was me telling them, how are we going to fix this, and getting gaslit.
Really?
So that put me in a very dark place until I was able to find someone.
Who was the doctor?
I saw Jose Lorenzo in Spain.
Really?
Yes.
See, that's
the technician that worked on my donor.
That is a classic example of what I'm talking about.
One of the best examples.
I know Jose. I've known him for well over 10 years. Like we first met in 2012, I think. I spent a lot of time with him, and he was the first guy. He was the first FUE guy to do the big numbers. He was doing the 6,000, the 7,000, the 9,000 graft cases, and his photos were great because he was copying what I did at Hassan Wong. He told me this. He's like, I studied how you do the photos, and this is why they look so good. I copied you guys. And he studied how to do, best presentation, all these things that made a lot of sense.
Hair transplant marketing 101.
And it was honest. 100%. Well, it was marketing, but it was honest marketing because he wasn't hiding anything with how he was doing things.
Marketing doesn't have to be dishonest.
I wrote the book on. There's a not negative connotation when you say marketing, so I'm just making sure people understand that it was very transparent marketing the way that he was putting it out there. And he was the first one on the planet to do these giga sessions. And he started doing this 15 years ago.
Well, but
he was doing a good job too.
But there was a time when he was doing himself. He was doing it by hand himself, and he wasn't having his technicians.
That's it right there, Spence.
Yeah.
That's it right there. Is when I started researching this physician, I was under the impression that he was doing under all the work. But when I get there's 4 operating rooms with 4 different patients, including me.
Yeah. What do you think happens?
1 technician each extracting. I got the technician that speaks English. Her name was Grace, but I mean, I'll share pictures
I
with
know
you guys
Grace.
one day.
I know.
Yeah,
I know Grace. Yeah.
I ended up with a very visible block of extractions on the back of my head. I was miserable, guys.
I'm so sorry to hear that. And
I'm sorry to hear that. Yeah.
but I will tell you that your story is not atypical. You hear stories about some of the luminaries in this field who start off as real luminaries, and then as they grow online on message forums, and they're like, all right, well, we're getting the business. We need to expand, and the only way to do that is this is only one person is to bring other people in, whether they're doctors or technicians. It happens every time. We see it happening in
Yeah.
places like, some great clinics in Turkey have had problems. We see it happening in India. You saw it obviously happening in Spain. It's bad, man. That's why, and sadly, the industry, because of the way that it's devolving, prices they're less expensive. Physicians need to work more on volume in order to make the same margins that they used to make. So they're cutting corners, and patients have no effing clue. And this happened to you, 10 years ago?
No, it was only like 6 years ago.
It's amazing.
Yeah, 6 years ago, and I wanted
Now,
to harp on
did you
that
ever
too,
think why
because
he wasn't kind of working with us?
it's a good question. It's a really good question.
I'm not going to say anything. I'm just saying, it's something that people really need to look at. And I'm not saying, I always tell people, you can get effed up by an IHS member. It happens. It's happened in the past. Some of the best doctors in the world have patients who feel their lives have been adversely affected by having surgery. But I got to tell you, man. Go ahead.
Sorry, during my consultation, I asked him a similar question, like, why aren't you part of the ISHRS? Something along those lines. And the response was something along like, oh, that's all like marketing. That means nothing.
Yeah. There are doctors. Well, I don't want to listen. I don't have anything against this guy. I'm just saying there's reasons for everything. And when you question anybody, they're going to have a response. And you can tell whether the response is honest or not in general. And yes, the ISHRS has its, somewhat of a marketing arm, but really it's more of a trade organization. And anyone who's in hair transplant surgery, in my view, there's nothing wrong with being part of the ISHRS. At the very least, you get to go to a meeting every year, you get to meet colleagues, you get to be involved with some of the hallway conversations. Doctors do hold stuff close to their vest as far as teaching other doctors, but at least you kind of get a vibe of what's happening in the industry. And you also get to hear from technicians who are not working with you. People are getting drunk, and sometimes they're telling the truth. I think it's important. I think it's important to be a part of these things. So I think that was in my opinion, that's a very disingenuous answer.
Yeah, but the main purpose of me bringing this up is for those young guys listening in. In my eyes, I did all the right things. I researched. I looked for as many results as I could. I looked for patient-posted independent results. I chose somebody who I viewed as having a ton of experience. But just like Spence and Joe say, surgery is always the last option because it can turn out bad. And in a lot of cases, then you can't go down the path of, taking the route of just shaving your head because then you're just disfigured. Then you have a square on the back of your head or something that, you're always thinking of. And in some ways, that's worse. So I beg all the young guys contemplating getting surgery, going through Reddit and seeing these results, do your research, be as conservative as you can, ask as many questions as you can, get a feel for the doctor's personality, not just their skills, because a doctor can have skills, But then if something, like in my case, if something goes bad and, then they stop responding to you or gaslight you and try to convince you that, everything is okay.
Yeah,
when
there's
it's
something
not,
wrong. Something wrong with
then,
you. This
then
is your perception, your body dysmorphic disorder. You
correct.
know.
And when you have barbers cutting your hair and telling you what the heck happened to the back of your head, that's my message: is be very, very careful. Exhaust all options. Use medications and tread extremely carefully. And don't trust everything you see online.
Brother, that's a very important message, and I'm so glad that you called. And I'm sorry that happened to you, and that you had to become a repair patient. The questions as you asked about these docs who are doing these really high volume cases, really important to bring up. It's funny because I brought it up to Joe before the show because someone had asked me to do a reaction video on that Brazilian doctor's latest case.
Yeah.
I don't even want to do it. I just don't want to do it. It's not going to be positive, except for, the patient looks really great. It's very possible the patient is going to have a better long-term outcome because he's older. But these are not typical cases. And the way that they're being presented and just the flash and the pizzazz of his Instagram, and he's got a big following. I think we're close in following at this point. For a hair transplant surgeon, that's a lot. It's, I don't know. I almost feel bad that that he may be listening to this because I don't want to make him out like he's some sort of a bad character. I just don't think that he knows.
No.
I just don't think that he knows yet. I don't think that he can. He's capable of doing something that most doctors can't do. He has the hands, the foresight. He's developing his AI, which is great. It's important stuff because you are able to actually see what percentage of hair is miniaturizing, looking at different color and caliber of hair that you might be able to utilize. Doesn't mean you can actually extract those the way that you want, but, whatever. Now he's kind of trying to set the standard or set a parameter where you're looking at lighter or blonder hair, which that's pretty, that could be pretty valuable if you're actually able to extract blonder hair or lighter colored hair that's not miniaturized to utilize in the frontal hairline to really create a soft, natural look. All smart ideas, but it doesn't necessarily translate into a long-term reality that people are going to be happy with.
Yeah.
And it's an important subject. And I feel bad for these guys on places like Reddit. I really do, because I know they're suffering, and it's almost impossible to get the right information.
I look at, just to expound on what Spencer was
Callers,
talking about.
we'll take your calls in a second. Hold on.
The technology that some of these doctors are pushing. I've seen a lot of cases where doctors focus too much on trying to differentiate themselves from everyone else by focusing on the extraction or the tools that they're using or the software that they're using or an AI that they're using. And there's a case, a scenario that I'll present to you where I see that as a problem is I won't name names, but a very early pioneer in FUE who came up with, they were so intense.
Name names. Why can't you name names? This is that's part of the show.
Well, I'll get to it. I'll get to it. Well, okay, I'll go and say it now. It's Dr. Ray Woods, when he first invented FUE, his focus was talking about how small the needles were for extraction because he was, the punches or whatever he was using. He never did expose or share what it was he was actually doing.
Let me stop you.
Tools,
he had a proprietary tool as well.
Yeah,
that sounds very familiar.
Every time I hear proprietary tool,
I
think of Ray Woods.
Yeah,
and he was very secretive about it, but he was always talking about how his big claim to fame was using this really high end microscope, the Zeiss scope that he was using, so he could really zoom in to super magnification. And what I was noticing about that, one of the many things was there is such a thing as too much magnification. It's like you can't do anything when the magnification is so close to where you not only see the base of the follicle, you see the opening of in the channel where it's actually going into. There's no benefit to that. Like there's nothing that you can see at that level that helps. You can't see through the skin. All you see is this big thick hair, and the exit point in the scalp, and it's kind of like a little crater. Like there's no benefit to that. There is such a thing as too much. But the point being, he was focusing too much on the donor. And I understand why, because when he was developing the Woods technique before it was even called FUE, that was the whole point of the Woods technique, was to avoid the strip scar.
1989.
Or punch scars. Punch plug scars or strip scars. That's what he was trying to avoid. And God bless him, he did a great job with it. But he didn't focus on what was actually the most important part about a hair transplant, and that's the hairline. He wasn't using that super scope for single hair grafts because of one important reason. He didn't know he needed to. He didn't use stereoscopic dissecting microscopes to really, to have a team of specialists identify, refine, and in many cases create single hair grafts where maybe there's not enough naturally to be used for a hairline. And I felt that, just my personal opinion, I felt like that his work suffered because of it as far as the naturalness in the front. Some cases looked fine, but some didn't. And the debate about microscopes, that's long over, because it's, as a lot of people like to say, it's settled science. But that's a joke. But when I look at the modern day mechanics, as Spencer alluded to, where they are focusing on the tools, again, I'm having flashbacks, and I'm seeing similarities with the final outcome. Donor area may look fantastic, but I'm seeing a little less refinement than I would normally like to see in someone that's getting so much attention for their work. And that's another reason why I think, maybe focus on the fundamentals of the surgery first and perfect it before you start to try and reinvent the wheel.
You know what I find interesting about that statement?
That's a problem I see.
And everything that you said, and I didn't want to interrupt you because it was so lucid. And I know that you have trouble with that sometimes. I'm just kidding. but when I would speak to Ray back in the day, when no one wanted to listen to him, all he would really focus on is obviously, the butchery that was happening. And there's a lot. But the importance and the value that he's investing in these Zeiss microscopes, this one Zeiss microscope. And the fact that patients were actually going to be able to see everything that was going on. So he had a screen in front of a patient, as if this patient wants to see that. And so that they can watch the entire procedure on a monitor, what was happening on their scalp, which is interesting. But that was kind of a very strong marketing sell that he was trying to put out there online. And people were continuing to fall for it. Now, I pushed his technique, and Bob Bernstein and Bill Rasmussen decided to take it and run with it, and take a chokehold on it and call it FUE, which is great. And all the other people that started to do it. But I told Ray at the very beginning, I'm like, you're still going to have to do a strip for people who need a lot of work. And no one wanted to listen to that. At first, the doctors were listening to some degree, and they're using FUE, in quotes, as an ancillary procedure. And then there were the guys, like our friend in Atlanta and some other people, who really took a chokehold on this thing and started to then kind of go the way of the Woods and say that strip was butchery. This is state of the art. Mm-hmm. And that was a bad message. Why not refine strip, take it, maybe able to utilize FUE with the strip and not have to take out as much tissue for a strip, and do a hybrid procedure where there's going to be a very fine line scar potentially, and cherry pick the grafts that you need, and still give people an option for maybe a second strip without a lot of tension. But utilize as much DHT-resistant hair as possible and do what Joe has said. You know, the result is really not just about the donor. It's about what the hair looks like when it's moved to your balding areas as well.
The whole point of getting a hair transplant to begin with. Right. And, you know, that's a great memory that you just brought up is when Ray would always tout the fact that there was a high-definition television in front of the patient, not for watching DVDs, because there was no streaming back then, or VHS tapes, but so that they could watch in real time each graft. Like I can hear it in my head now. You can actually watch each graft being taken out one by one in real time for your own personal inspection. And I kept saying to myself, what the fuck do patients know what they're looking at? Like how they have no. You could tell them that this is a perfect graft and it's got 3 hairs sticking out of it, and I'm going to put it in your hairline. They'd be like, okay, you know.
I really tried to help this guy. I really, really tried, and his level.
No clue what they're looking at.
But his level of paranoia. I mean, at one point he kind of like went off on me online saying that I tried to price him out of the box. The whole thing was just nutty, man. All this guy had to do was show people his work, really keep it as the Woods technique, have it published, and license the technique to all these doctors. Relatively small fee, $1,000 per procedure, and he would be just sitting pretty. But instead, he wanted to charge $100,000 just to train these guys, not show them the tool right away either, from what I remember. Mm-hmm. And I'm just like, I mean, there's going to be doctors who are willing to pay that, but wouldn't this be better?
I think there was none.
Yeah. Like if
actually, I mean, when you look at it, it wasn't a bad deal. $100,000 to get trained in the only FUE method that was out there by the guy that invented it, and then you'd be able to say,
but once
I was trained directly by the guy that invented it.
Once our American friend, once our Canadian friend decided to start promoting it on Hair Loss Help, after I walked him through the procedure. And then it was like, wait a second, this guy's doing it? And then guys in Greece started to do it. And then, you had a couple of other guys who were doing it kind of behind the scenes, like Alan Bauman, who actually created the first punch actually for FUE. No one gives him credit for that. I think it's a Mindy punch or Mindell. Sorry, Alan.
Miltex?
No, not that. Something, the Mindy. I don't know. But, and then you had Alan Feller and all these guys. Anyway, caller, this has been a great call. I forgot your name. What's your name, John?
It's John, yeah.
Yeah, John. Yeah. Well, listen, man, I'm sorry you went through what you went through, but, I mean, the history of this is just wild. And what's interesting, these two doctors you're talking about don't really know the history. They hear the history from guys like our friend in Atlanta. They don't know the true history of this procedure and all the real pitfalls that they will see coming back through their practice. Or eventually somebody's going to go online and rip these guys a new a-hole, unfortunately. Because that's what's going to happen.
I think Spence, you said this before. A lot of the posts and a lot of the marketing is on these forums, and you said it before on your show that to become recommended by these forums, you pay a fee, and that fee comes with protection. So if there's any posts, some of those posts are going to be censored, negative posts, I mean. So these are things that the average person coming on these forums and kind of not being aware of it needs to really be aware of.
And that's partially why there's some doctors out there who were at one point part of the IHRS who I've either decided to not work with or we had issues. They were concerned that I wouldn't do that. They were concerned that I'm going to come online every week and say surgery is a last resort. They were concerned that I would not offer online consultations, which have some legal issues that no one talks about. Like, I'm not going to sell surgery. Save that for the forums that you're a part of. They'll sell your surgery. Yeah. They'll protect your asses. So anyway, Don't get me started. This has been 20 some odd, almost 30 years of dealing with some of the worst people and the craziest stories. I don't even know why I still do this sometimes, but I'm glad I do. You know, when I get callers like you who've been listening for a long time, and you can come back and tell your story to others, I think this is important work.
Yeah, if I can use my story to help one young guy out there, it's more than worth it.
All right, brother. Listen, thank you
Like
so
you
much.
say, this
Yeah,
is a disease of the
spirit.
What is it? Disease of the soul.
Yeah.
Or spirit. I'm sorry.
Disease of the spirit,
Yeah,
brother.
it's been great, guys.
All right, man.
Yeah,
You've been great.
talking.
Thanks for calling,
Thanks, John. Take care.
Bye-bye.
888-659-3727. We can go on forever. And then people are going to be like, what do they know?
Oh, there's so much more about that. Like the
Guys, hold on. We'll take your calls in a sec.
You touched on, like, I remember thinking this, and this is a beautiful representation of the hypocrisy in this industry by doctors, where one of the greatest proponents and screamers from the rooftops about the beautiful artistry with FUE, one of the early guys in the States,
is now like anti-FUE.
No. He's anti-strip. He stopped doing strip altogether, saying it was butchery.
Oh, that guy, yeah.
And then if you were to ask him today about his strip work, he would say, as he's always said, that he was one of the best.
Yeah.
So it's like if you were one of the best at FUT, then why do you call it butchery if you were so good at it?
Absolutely.
And it's all about the opportunity to market himself.
Dude, and this guy,
That's all it was
this
about.
guy first contacted me, and he's like, he wasn't in my book, and he wasn't part of the original The Bald Truth list of doctors. And he's like, this is how he introduced himself. I could transplant circles around your doctors. And I'm like, I don't have any doctors, first of all. I don't know what you're talking about. And he explained The Bald Truth, and this is before the IHRS. That's how he introduced himself to me. And at the time, he was working for a clinic that was like a known butcher clinic.
Yeah.
But he was saying, like, you know, in his office, and it was in D.C. area at the time, they're doing things differently. I never forget that phone call. I was like, this is a very interesting introduction. And it's been very colorful ever since, actually. Let's see who this is.
Absolutely.
Hey, you're on the air. Who's this and where are you calling from?
Hi, my name's Joe, and I'm from Boston.
Joe from Boston.
Hello,
Welcome
Joe.
to the show, brother.
What a fine name.
Hey, I'm
there, sir.
very happy. Well, thank you. I'm very happy to be here with you guys.
Well, good. We're happy to have you.
Thank you. I'm calling in because I have SMP, and I'm 36, and I noticed my balding probably in my late 20s, and I always had long hair, very long hair. We're talking 18 plus inches. And anyway, I decided to shave my head, SMP. But I think about hair. I miss my hair every day. And I've never gone on medication because I was afraid of the sides. And I know it's overblown, but I am married. I don't have kids. And my wife and I are like possibly having kids in the next year, 2 or 3. We're still undecided. And I just didn't know if I'm really just too worried about the meds. I really should jump on the meds and see how it reacts to that. I posted my pictures online, and everyone's just like, oh, get on the meds and derma-roll spin and min, and you might get major regrowth. My hairline's gone.
Fucking
like
derma rolling, man. This derma rolling nonsense. Go ahead. I'm sorry.
I don't know, man. I don't know. I just wanted to talk to you guys. You guys are pros. I miss hair. I really miss hair. It makes me look younger. Makes me feel better.
Tell me about it, man. Why do you think I still try to pull off this comb over? I'm doing my best. I'm almost 60. Yeah. Right, Joe?
Yeah.
You like when I say that.
Yeah.
But
he's almost 60 for crying out loud.
Yeah. But listen, brother, here's the thing. And I'm glad that you called. These medications are real, I'm a big believer in using a 5-alpha reductase inhibitor. I've done very well on one for finasteride for many, many years, 30 years. But even though we've seen no issues with people impregnating their wives or whatever, significant others while on the medication, you don't want to be that anomaly. And you don't want to ever have that in your mind. That's how I feel about it. So if you actually are planning on having a family, while early intervention is key, I couldn't personally tell you, and I can't give you medical advice anyway, to jump on finasteride when you're trying to possibly get somebody pregnant. Now, I know plenty of people who've had very healthy babies. You got Andrew Zarian, who's been on the drug for like well over a decade now. He had 2 great kids, and I know Spencer Stevenson. I mean, you're talking about public figures that are part of the show. You may not know them, but and countless other people. But I think it would be irresponsible for me to say, you know what, get on this medication. There's absolutely no risk to having a family. That's how I feel about it.
I guess, thank you. I just wanted to input one more thing. My hair loss has seemed to have slowed down significantly. I'm thankful. I still have a lot of hair. I shave my head, once or twice a week, and I still have a lot of hair. It's just my hairline is gone.
Right.
And I spoke to a surgeon. I know it's a red flag, but I spoke to a surgeon in New York, Blake something.
Blake Bloxham?
And, yeah.
Yeah.
And he was recommending FUT, and I wouldn't have to jump on meds, but obviously I'm going to have another surgery down the line because I'm going to continue losing hair with age. But I just feel like I've plateaued these last 5 years because my SMP is still great, and I don't have any exposure to new baldness. And so maybe I could have a kid in this next 2-3 years and then jump on meds, and hopefully the hair loss hasn't progressed too much and I can actually rebound.
Well, if you slow down, then that's possible. But let's talk about you having surgery or FUT at this point when you are wearing your hair. Basically, I'm assuming you're buzzing your hair to look like you have a shaved head.
Yes.
Okay. Now, you won't be able to do that if you have a strip surgery.
Right. I would grow my hair long again to 18 inches if I could. Or am I being too romantic with how nice my hair would be?
You are really not being realistic. It's possible, depending on how much hair is moved. And first of all, when you're dealing with having a transplant, shorter the better. That's just the way that it is normally. Will you get what you want from one strip? Maybe. I don't know. I don't know what your Norwood classification is. But you will have a visible scar on the back of your head, and you taking the ability to shave your head and live your life the way you are, looking good with a shaved head, off the table. That's done. SMP, finished. No point anymore.
Mm-hmm.
And
SMP wouldn't be able to cure that scar on the back either, really?
If you shave your head, it never looks completely right. Even the best SMP into a strip scar, if someone looks close enough, will see something's going on. I've seen some good work, but go ahead.
The ideal SMP into scar is when the hair above and below is at stubble length, so not like shaved to the skin.
Right.
It's a nice blend, but the problem with scar tissue is it's unpredictable when it comes to SMP. No SMP clinic should ever, shouldn't guarantee anything, but should not encourage patients to get SMP into the donor scar as a matter of a reliable outcome, because it's not reliable. It's not skin. It's scar tissue. The modeling of it is more porous than healthy skin tissue, and so there's a higher likelihood that the dot that you get from SMP will spread sooner rather than later, and become this blurry blotch instead of a sharp point. And that's not what you want.
So what Joe's trying to tell you is it's not a good idea. And I
I've seen great results.
Yeah.
So smart.
Well, I've seen great results
You
on
guys got
people
all the
who needed to get this done because they had strip scars and they were tired. They didn't like their transplants, and they were like, "Look, I'm going to shave my head. I'm going to get this done." But you're starting off with a clean scalp, no scars, and you're considering getting a transplant just to get your long hair back. That is a possibility, but it's very unlikely. Very unlikely.
Also, another question. Do you think it is pretty much outrageous to recommend a hair transplant when someone's not on meds and doesn't plan on getting meds?
Well, I don't love that idea, but I know in that particular practice, that's their MO. They, in general, don't recommend. I know that Alan Feller was not a big fan of using finasteride, and I'm not 100% sure why. He expressed publicly that he felt that there was too much of a risk, and really a couple of things he said was his job was not to medically treat hair loss. His job was to move hair. That's what he has said several times in the past. Now he's not even performing surgery that I'm aware of anymore, but Blake trained with him, and he basically works for him, even though I think he's a partner in the practice. But he's basically working for Feller, from what I understand. And that's how they practice medicine. I'm not a doctor, but as someone who's been doing this for a very long time, I think that is setting people up for long-term failure.
I feel the same, kind of, because you're going to continue losing hair, and that just means further surgeries. And
yeah.
Okay. All right, well, thank you, gentlemen. You guys answered my questions. I guess I guess we got this family situation first.
You know what? Just monitor your situation.
Hop on meds.
Monitor your situation. You can talk to somebody about potentially hopping on oral minoxidil, and hold off on a 5-alpha reductase inhibitor or anything that blocks DHT until you have children.
Mm-hmm. Minoxidil would be safe. Oral, you think, would be pretty good?
Well, again, I'm not a doctor, but there's been no talk or studies that I'm aware of any potential adverse side effects as far as causing birth defects in children, in male children. So, but I mean, it's still a medication. But listen, people are on medication all the time, getting people pregnant. You can look into that. You can talk to your doctor about that, but it's not something that's talked about or even written about. And I will say this, to be clear, every doctor will tell you that it's fine to get on finasteride. You don't have to worry about it affecting, or most doctors, affecting your wife or your unborn child. I'm not quite as cavalier with that.
Right. You kind of one chance to do it right.
Well, it's not even one. I don't want to ever. If it were me having a kid, I don't want. If something happened, I don't want to think about. Oh my God, I hope the kid is okay. And if something happens, was it this drug? I never want that on my mind. And I think that's, I think that's fair to put out there for people who are asking me that question.
Yeah. Well, all right. Well, thank you, gentlemen. Thank you, guys, and I really like the show. I appreciate your time. Thank you.
All right, brother. Good luck. Hang in there.
Take care, guys.
Bye-bye.
Bye-bye.
See ya.
888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hello?
Yes, hello.
Me?
Hello.
It's me.
Hey,
What's up?
Alex from Florida. How's it going, guys?
Alex from Florida. How are you, man?
What's up, man?
Good. I used to listen to you guys' show on the radio like 20 years ago.
Joe wasn't on the radio with me, but
you.
I bet you he wishes he was.
Absolutely.
So where were you listening? Were you listening in Miami?
No, New York at the time.
Wow.
So,
Jesus.
but yeah, I mean, you guys have been great. I think there's just so much bullshit in the industry, and I've always, looked to you guys and your blog and everything. So I got a couple questions. So I've been DUPA since I was about 20 years old. I'm in my early 40s now. And I've been on finasteride for 24 years.
Okay.
And actually, my first doctor was one of your favorites, Orange Reich, and then I moved over to Dr. Bernstein.
Okay, so you are old, man.
No, the younger Orange Reich.
Yeah.
But yeah, I am old.
Yeah.
I'm not as old as you, but
Yeah. Well, who is? I'm almost 60.
So, so I was, and I did. Do you guys still work or associate with Jeffrey Epstein in his clinic in Miami?
Yeah.
So they did some SMP on me, and they did it very conservatively. With my pattern, it came out good, and I guess going there was the first time that anyone ever said that I could actually get a transplant, which was the idea. The suggestion is to take, maybe 500 healthy grafts from the back of my head that haven't miniaturized, and then a few hundred grafts from my beard. And I was just wondering, what you guys know about the beard to scalp and how that's worked out for people, and who do you think is the best person to do that?
I know you're not quite as old as I am, but how old are you?
44.
45.
44, yeah.
44, okay. Again, Joe said something interesting before, which is something that I think everyone should kind of abide by, including all these physicians. Just because you can do something doesn't mean that you should. And given that you're still relatively young, it's possible that moving 1,000 grafts, 500 of your non-miniaturized grafts, even though you're dealing with DUPA, and that's diffused unpatterned alopecia for those who don't know what that is, and using some beard hair with SMP, I've seen some nice results that really provide a kind of a three-dimensional look. But every time you cut, brother. There's going to be some level of scarring, even if they're only removing 500 grafts from the back of your head. And then there's also the potential of some degree of scarring in your beard. Now, if it's done well, it's usually pretty undetectable. And it's usually under the jawline. If you have a strong jawline, you're never going to see it. You've been living this long. And first of all, are you comfortable with your day-to-day life right now, just living with your SMP?
Like 80-20.
Okay. 80's good.
Before the SMP, I was, using some cover-up stuff, but yeah, it's not catastrophic.
Okay.
Especially, when I look at people that I went to high school with that didn't kind of pursue early intervention, who are now totally bald. It's not like, it's not an emergency or anything, but, I would, in the crown, not the crown, the front, not what's the part that's the front, but not the hairline, like the front part of your
mid-anterior scalp.
Yeah.
Yeah. So I'd like that to be thicker. I mean, even without the back hair, even if it was just the back of the head hair, I mean, it was just beard hair. I mean, that would, and I wear a beard already. So that would, so I was just looking for some density basically up there.
Look, it can be done, but it's still surgery. Anything can happen. If it's not something you really, really desperately want, and you're only looking at it because it was suggested that it's possible, then, it's funny when people are given options that they didn't think they had before, all of a sudden they're thinking about potentially jumping into surgery when they may have been just fine or okay, good enough without it. If no one had offered this to you what would you be thinking right now? You'd probably be thinking, well, this is what I have, and I feel pretty good.
Well, just to be clear, in fairness to the medical office, this is Dr. Barrett who works with Epstein. They didn't come in and pitch me on it. I saw it on their website, and I didn't know that this was possible before. But so to your point, yes, but I just don't want anyone to think that they're cold pitching patients.
Well, no, and I appreciate that. I appreciate that. That's a very important, thing to point out. It's hard for me to say go for it, and I'm not a doctor, but it's hard for me to say go for it, especially in your particular situation. I'll let Joe maybe be the bad cop or the good cop.
How does it age? Presumably, the finasteride, maybe with finasteride, it'll continue to, slowly thin. How does a beard to head transplant look, 20 years from now?
I'm not a fan of beard to head, only because I've seen too many cases look like it's beard hair put on the head. I'm not a fan of it. It's beard hair, and it looks like beard hair on your beard, and newsbreak, it looks like beard hair on your head. It has to be done a very specific way. You have to have a very specific kind of beard hair. If you're one of these guys like me, where you have medium brown hair naturally, but your beard has a bunch of mix of light brown, red, dark brown, where it's like a calico cat. It's not going to look very good, especially if your hair is straight but your beard is kind of curly or wavy, right? I mean, the texture does not change. Now, there's very little, but anecdotal evidence that the beard hair can soften, but that's over the long term. Okay. So a year and a half after you have your hair transplant, if you have shitty looking beard hair, it's still going to look like shitty looking beard hair on your head. Nothing can change that. Hair softener can't change that. Proper angle and direction can't change that because it's curly or it's wavy, and it's it's a gamble. And so when you look at your beard, just like with body hair, okay, I'll talk about my case in particular. I have salt and pepper medium brown hair. My body hair is medium brown, and it's fine hair too. There's a little bit of a wave to it, but it's moderate.
And what are your pronouns?
Exactly. And it works. It blends with my scalp hair just fine. I'm a great candidate for a 3,000 graft chest hair transplant to my anterior mid scalp and crown for added density. My beard, I wouldn't trust it. It's more white than anything right now. But I'll never forget. I was sitting at a dinner table, and across from me was Dr. Arvind Paswal of India. I was in Italy for something, I forgot why, but and he wouldn't stop staring at me. I've told this story before, but I've known him for many years, but he kept staring at me, and I'm like, Doc, what's going on? And he goes, I'm sorry, but I can't stop staring at your beard, because I started wearing a full beard at that point. And he's like, I could do so much with that. I'm like, we're at dinner, stop working, But he told me
he wasn't working.
Easily get 3,000 grafts out of my beard, and no one would be able to tell because I have so much beard hair. And if I wasn't me, if I was just a patient that just walked in with a bunch of beard hair, I would have fallen for that line, hook, line, and sinker. God knows how it would have turned out. Nothing against Dr. Paswal. I like Dr. Paswal. I've known him for many years. But beard hair it's not consistent. I've seen some of the reputed best doctors in the world work with beard hair, and the outcome looked like shit. That analogy I used at the top of my response to you, it's beard hair on your beard, so it looks like beard hair when it's on your head. It doesn't change. It just doesn't.
Okay.
It
Yeah, 'cause
doesn't
he
mean
had
it
said
can't. It
he
won't
could-
turn out fine. Okay. It doesn't mean it won't turn out fine. But and this is to everyone listening. If a doctor tells you that it will turn out fine, get them to justify it. Get them to break down why. Talk about texture. Talk about color. Talk about wave, curl, or the lack thereof. Talk about the differences, the contrast between your beard hair and your scalp hair, and how will it blend. These are serious questions you gotta have the answers to, and then you have to understand what the answers mean. So it's a big deep dive on your end.
Okay.
Again, talking to everyone. Yeah.
So yeah, he said that he could get like 400 out of my beard.
Okay.
And my beard hair
Okay.
is like the individual hairs are thick, but it's not like the density isn't that great.
Well, see if you
So he
can
was
meet any
saying it's
patients
more
of his,
like,
any local patients who've had beard hair from him.
Okay. Yeah, that makes sense.
Yeah, and see what you think.
But
I mean,
let me ask
do
you
you
this.
guys have another recommendation of like a surgeon
Well, hang
who...
on. Hang on. Let's back up. So it was 400 grafts. Can you repeat your hair loss pattern? Like how many grafts are you talking about total for the loss that you have?
I think he had suggested a few hundred, as many as 5 from the back of non-miniaturized, and then 400 from the beard. Or maybe it was even less than maybe it was like 200 from the back, or something like that. But we're not talking
so
about
between 600 and 1,000 grafts.
Substantial number of grafts. Yeah, it's not a substantial number of grafts, obviously.
And this is for the anterior mid-scalp region behind the hairline?
Yeah, so he was saying that the hairline he could do a little bit of work on with the hairs from the back, but the kind of the density on the top of my head would be the beard, and then he would just recommend to continue doing SMP on the crown, as needed.
How long is your hair? Is it a normal length that you can style, or is it shaved?
It's not shaved. It's like maybe an inch on the top, and it's like number 2. It's like number 2 and 3 on the sides, and then probably like a 7 on the top.
Okay, so a good length, a couple inches. So, what is your hair loss pattern like? Have you had surgery before? Why such a small number of grafts?
Well, it's DUPA, so like I.
Oh, that's right. Okay, sorry.
Don't have a donor area.
Yeah. Okay. If it were me, I would stick to the way I always look at this. Beard hair is a last resort, and I would look at doing a test. I even hate calling it a test, but I would say use the scalp hair first and see what you can do with it. Don't go for, if there's any viable scalp hair to use, don't dip into your beard. Don't mix it.
Mm-hmm.
Okay, hair transplant surgery itself is already an inaccurate science. No two patients turn out exactly the same, and no doctor that's been doing surgery for any number of years has the same high quality outcome for every patient. Okay, so that part, and that's just using scalp hair. So there's no consistency 100% just using scalp hair. So then you throw in the mix something that's even less reliable, which is any sort of non-scalp hair, beard, chest, back, whatever. Then you're adding more variables into an already less than perfect procedure. So, you have to ask yourself, number one, is it worth it? Because it's a small number of grafts that you're looking at, under 1,000 grafts. Is it worth it for your end goal? And then is it worth it to take a risk with, less than ideal donor for the scalp, and then even less ideal donor having to use beard hair. And keep in mind, this is sight unseen, and I have to speak in some generalities here, but is it something that you have to do given your situation and the number of grafts that's being suggested is pretty small? Can you get by without it?
Yeah.
I think Spencer asked earlier.
Well, I could. I mean, this is an elective surgery, so
Well, yeah.
can I survive without it? Yeah, probably. I mean, I just think it's, and that was my other question, is that say it goes perfectly, like how substantial, noticeable are the results if we're only talking about this many grafts? Like, am I going to feel?
What's your hair color?
So my hair color, so on the top, it's like a darker brown. On the sides, it's pretty gray. There's some grays mixed in at the top too. And then the beard, I would say, is like 70% gray, and then brown.
And what's your skin tone like?
White boy.
Okay.
Can tan a little bit. But
and what are your pronouns?
So with your,
I'm just kidding, Roger.
Your pronouns, and and so you basically have a fairly high contrast between scalp color and hair color on the top.
Yes. So yes.
Yeah.
That is definitely true.
So, I'll put it like this. You generally need more hair to give a visible impact for perceived density when there's a higher contrast ratio between hair color and scalp color. Lower contrast ratio, not as much. Because the scalp stands out more through that high contrast, right? And I just want to say, I'm not trying to bring you down on this. It's just you have a limited situation. You have a precarious situation with your DUPA, which by definition means that you're not a great candidate to start with. So I'll just say this. I think that if you can get by with your S&P, which you've already done, and concealers like Dermatch, I would say forego surgery. I would say avoid it. Because
I would never go back to the concealer.
Okay,
just because
fair enough.
The anxiety about getting stuck in the rain is like too much.
Yeah, no, I get it. It's just you're taking a risk that I feel is bigger than what the average patient is taking because of your particular circumstances where you're not the ideal candidate. Virgin scalp, but you can only maybe go for a few hundred scalp hair grafts and more beard hair than scalp hair. What are you going to do for your next surgery? Not a fan of it. I would look at the medical options that you have instead of the surgical options.
Okay. I mean, do you guys who comes to mind as the best beard guy that you guys work with?
There's a lot of guys who do good beard hair. So I mean, just even the best guy, if Barrett or whoever you saw, even see Epstein, if his associate was the best in the world, Joe would give you the same advice.
Yeah, 100%. Yeah, and I need to be clear. My advice had nothing to do with the doctor that you're seeing. Like I don't know this guy that you're talking about. I know Dr. Epstein. I think he's just fine, good guy, and I think he does good work. But it doesn't matter who it is. No doctor can change the physics of light and your physiology as far as I'm talking about the physics of light because of how your scalp looks. But they can't change the physiology of what they're working with. No doctor is a miracle worker like that.
And they have no crystal ball. They have no idea what your outcome is going to be. So.
Yeah. It's all it's all speculation as to how it'll turn out. So
I wouldn't do it.
Did you? I overheard the I remember you saying the finasteride thing is not something you really want to jump into right now. You got some anxiety about that. Totally understandable. Did you talk about
I
oral
said
minoxidil?
concealer. No. I think
okay.
you're thinking the last guy.
Maybe.
No. I've been on.
Are you?
Actually, I was going to ask if you guys, at least anecdotally, have an opinion on switching to topical finasteride versus the oral.
Why would you do that if you've been on
Why would
oral?
you do that? Yeah.
My urologist was recommending, like, as you get older, you want to, cycle off
he's an
these
idiot.
drugs, at least in your system.
No.
Why would you?
If you
why
don't
would
have any
you-
issues with it, then there's no reason to stop.
I'm curious. Why would he tell you that when this is a drug that's been prescribed to older adults for 30 years?
Well, I mean, his point was just like, no one knows what the long-term impacts are for younger people, and I mean, I didn't.
Yeah, we kind of
I
do.
didn't listen to him. I still take it.
Yeah, we kind of do know. Like, it's been around for 30 years now, so we have a pretty good idea. But regardless, I mean, but there's also the question of oral minoxidil. Have you considered that? Have you looked into that?
I got fairly low blood pressure, so it's
Mm-hmm.
I probably wouldn't do that. I do the topical.
Okay, well,
I buy like generic. I buy generic Latisse from India, and I drop it into minoxidil. Haven't burned my head off so far. But no, I wouldn't. I probably wouldn't do oral minoxidil.
Okay. Well, I mean, there's low dose, so you have low blood pressure. I understand that, but low dose minoxidil might not have an effect on it. It's something I think worth talking to your doctor about. Like, it can't hurt to talk to him, just to get their opinion on it. But again, back to the point of the surgery.
Genetic tests? Sorry, are those genetic tests real? Like when they take your blood
real,
and
yes.
they tell you
But they're not entirely
which drugs
accurate.
will help you. Okay.
No, I don't think they're accurate. I had that done, and it was telling me that I should get off of finasteride and try dutasteride. I've tried dutasteride, and it made no difference for me, except it made me, look like I had been eating ham sandwiches too much for a couple of years. Like I bloated. I got big, and it wasn't a good look, and it made no difference for my hair. I went back to finasteride, had no shed, no nothing. Everything's fine.
I mean, I could tell you after being on finasteride for a couple of years, or I asked Orange Reich about dutasteride, and he gave it to me, and the side effects were pretty. I had no side effects on finasteride, and the dutasteride side effects were pretty crippling.
Yeah.
Actually.
Well, listen, brother, I think that, Joe's advice is good advice. My instinct would be not to do it. At this point, surgery's always going to be there. You're only 44 years old. Let's see how you do the next couple of years, how the SMP holds up and how your overall look holds up. And you could always circle back when you're 46 or 47.
Do you guys see any technological or medical advancements happening in the next 5 years?
Honestly, brother, with AI, who knows? I'm hoping it puts me out of a job.
It'll be great for all of us.
100%. I'll just be day drinking with incredible hair somewhere. All right, brother. Good luck.
All right, guys.
All right, take
Thanks.
care.
Have a good night.
Okay, bye-bye.
Thanks for calling. Bye-bye.
I know you got to go, Joe, at 5 sharp, so sorry,
Yeah.
guys, who are holding on. We really are sorry, but Joe's got to go. So let's say goodnight to everybody. Guys, I would normally go live on Instagram after this show, but I got places to go. I got something to do. So I'm not gonna go live. But maybe I'll jump on Instagram live tomorrow or sometime.
What's his pronouns?
Good timing. Sometime over the weekend, maybe I'll jump on live. Guys, I know you keep calling in. It's great that the phones are lit, but you know, could have called in a little earlier, might have gotten through. So, until next time, follow Joe Tillman at Joe Tillman Official on Instagram. I'm at Spencer Kobren. Follow us. We'll get you some, we'll give you some info. Do our best to provide some content. Until next time.
And hit the like button.
Yeah, hit that like button. Until next time, be strong. God bless. Thank you so much for listening. Have a good night.
Good night.
Oh,
great. Another copyright strike.
damn it. Sorry.
God damn, boy, what's that? Some kind of weed or something?
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.